Today we are going to be speaking about Germany versus America in the healthcare system. So first of all, how are their systems funded? Both America and Germany's healthcare models are different to each other, even down to the way they are funded. Germany on one side has mandatory healthcare insurance, and it is not funded by the government, but rather by general wage and dedicated supplementary contributions. Although healthcare is offered to all patients and all citizens for a cost close to nothing, those who make over a certain amount, which will be around $60,000 a year, can branch out and look for a private health insurance that they think will benefit them more. America, on the other hand, is different, as the government only funds for insurances such as Medicaid and Medicare, which is limited to only a certain amount of people. Each state is also responsible for funding local coverage, and a system like this can honestly strike big issues for those who do not qualify for either insurances or those who are low income seeking. According to the PBS Frontline, Germany's healthcare system offers funding for many different reasons: mental health, dental health, optical care, and overall health. Germany also will fund even alternative therapies, which can include yoga or even going to the spa. This shows that Germany really does care for more than just physical health, but a patient's mental health and well-being overall. This is a different case from America. They are not known for funding alternate therapies, and they do not fully fund optical health and will only cover some medical exams. America only covers basic health needs and does not provide it for everyone, and it is not guaranteed for everyone. What is the wait time in being treated? Both America and Germany have similar wait times when visiting an emergency room. According to research, Germany has an average wait time of just 22 minutes, while America has a wait time of 24 minutes, which is both similar. Although if you're looking for an elective therapy, Germany has an average wait time of 4 days to see a GP, and it takes around a month to actually receive your surgery. America's average wait time just to visit a GP is typically 21 days and is around 28 days in waiting for surgery as well. So both of these countries have a similar wait time to get their needs, although America waiting for a GP is a little bit on the longer side. So this leads to, what is the satisfaction rate in each country? Well, in a recent survey, reports show that only 34% of patients in Germany actually view their quality of healthcare as good. That leads 66% of the patients to point out flaws in their system to improve. On the other hand, only 11% of US adults consider their quality of healthcare to be excellent, and another 33% rates it as good. These rates are similar, which lead us to think that there could be major improvements in both countries and in both systems, whether it be patient care or waiting time, etc. Staff shortages in both countries. In recent studies, it is shown that Germany has been recently facing a lot of labor shortages, one being physiotherapy, following up with dental assistants. These shortages can cause major issues such as a longer wait time or poor health care or poor service quality. In America, healthcare workforce shortages are also increasing drastically. And it is predicted by the Association of American Medical Colleges that there will be a major shortage of over 85,000 physicians by the year of 2036. Hearing these reports could be upsetting, knowing that there are many positions vacant and many patients that seek medical help and appointments. So, what is the mortality rate and life expectancy of each country? According to the figures of the Federal Statistical Office, in the second quarter of 2025, around 2,300,000 people died in Germany. Their death rate comes to 11.77, which is 0.13% increase from the previous year. The US has a death rate of 9.28%, which is an increase from the year of 2024. 236 people died in Germany. Their death rate has been increasing since the previous years, as well as the US. The US now has a death rate of 9.28%, which is a 0.59 increase from 2024, and Germany has a death rate of 11.77, which is a 0.13 increase from the previous year. Both countries are struggling with keeping their death rates low, and that could be a major problem in the future for both countries. Life expectancy of a country is also very important to remember and can also reflect the exact care that their citizens are receiving. According to the CDC, the US's life expectancy is at 78.4 years. That can be extremely low considering their high income that they are receiving and that they are not a third world country, but they are very well developed and have the technology to continue healthcare at a higher rate. In Germany, their life expectancy has gone up significantly, improving by 2.39 years in the year of 2021. Their current rate right now is at 82.20 years, which is a slight increase from the year of 2024. This life expectancy is considered good and is higher than the average one in America and can lead others to think that their healthcare system model could be the reasoning behind this. Suicide rates in both countries. Mental health is something Germany also focuses on tremendously. As mentioned in slide 1, Germany has a lot of resources for their patients, considering they can attend spas and homeotherapy and even just regular therapy. In 2021, Germany's suicide rate for 100,000 people was at a 12.3, while America's average came to 15.3. These rates are slightly high considering the amount of income these countries are making, and it really puts a focus on whether mental health should be prioritized in the healthcare fields more. The health outcomes of each country. For Germany, according to the WHO, Germany's health outcomes have decreased throughout the years. They have a decreased population, and their population trend is also decreasing due to having more deaths than births annually. Many sources also state that Germany is spending billions on healthcare but fall short compared to neighboring countries. They also have a significant increase in deaths caused by heart disease in recent years showing. In America, their healthcare system has also decreased according to many Americans. Reports state that it is very difficult to obtain healthcare because of its cost, and it leaves many patients unable to access basic healthcare, leaving them to also put it off and not see it as a priority in their lives. The cost of prescription drugs have also increased, which puts patients that are low income in a tough position, not being able to afford their medication that will keep them healthy and alive. Their population also seems to be increasing, and it grew from 1% from the year 2023-2024, which is also very good. But disease in America has also seemed to have an increase throughout the years, especially since COVID, and it has affected many aspects of the country. That is all for today. I really hope you enjoyed viewing my presentation, and I hope you guys have a good day.